thought to affect 50% of the population by the time we're 50 years old? What am I talking about? Well, I'm talking about hemorrhoids or piles. In today's episode of Dr. Nora, I take you through everything you need to know about hemorrhoids or piles, from what they are, what causes them, what symptoms you may be experiencing, and what treatment options are available, and more importantly, how to avoid becoming a statistic. First up, what are hemorrhoids or piles? Well, these are often known as varicose veins of the bottom. In this area, we have lots of vessels and veins that carry deoxygenated blood from this area back to our heart for reoxygenation. If this blood flow is hindered by some means, for example, straining or pressure on this area, then you can imagine the blood flow is not going back to the heart, and so what happens is you get a bit of distension in that vessel or vein. Gradually, over time, over a slow period of time, these vessels become distended and they become fat and knobbly, and hence hemorrhoids are produced. Now, hemorrhoids can be classified into 3 different categories. For the sake of this video, I'm going to keep it nice and simple. The first category are internal hemorrhoids. These are hemorrhoids that develop from the inside of the passage, and they may be painless. However, they may bleed, and typically somebody may present with symptoms such as fresh bleeding. That means really bright red blood on the toilet tissue or in the toilet bowl or even around the feces itself. Note, it is super, underline this a million times, important that if you do have any bleeding from your back passage that you speak to your doctor ASAP, because it may be something as simple as hemorrhoids. However, it may also be something a little bit more sinister as well. So please make sure that if you are experiencing any of these symptoms, you go and speak to your own medical doctor for a history and examination. The second category of hemorrhoids are prolapsed hemorrhoids. Now, these are internal hemorrhoids that have now become external. These very often are very painful, and a lot of people will know that they have a hemorrhoid because it is so excruciatingly painful. These hemorrhoids arise from internal hemorrhoids, as I said, but what happens is that after a bowel motion, they pop out from the outside of the bottom. Now, over time, if there is lots of straining, for example, on the toilet, there may be something called strangulation. And what happens is those distended veins that we spoke about earlier later no longer become reproducible, meaning that they don't go back inside after you've passed the motion, but they always stay on the outside. And so one might say that they have a little lump on their bottom. The third category of hemorrhoids are external hemorrhoids. These are small bleeds, if you like, that occur under the surface of the skin around the anus, and they can include things such as skin tags or other lesions as well. But the important thing to note is that they've developed from the outside rather than the inside out. So there you have a brief categorization of the different hemorrhoids, but what symptoms may they typically cause? Well, we've already spoken about a few symptoms already, but one of the commonest things that we often see in general practice is people coming in with bleeding from their bottom. Now, generally this could be fresh blood, so that means bright red blood that could be, as I said, on the toilet tissue, in the toilet bowl, or around the feces itself. In some situations, hemorrhoids can be extremely painful. Now, often you'll see the patient coming in and you'll know probably what is going on because they won't be able to walk properly. They'll be sitting down a little bit funny and they'll say, "Doc, I'm really uncomfortable." And that can often be quite embarrassing for people. But I must stress that this is something that as general practitioners, we see a lot of in practice. And so please do not feel embarrassed to go and speak to your doctor if you are experiencing problems. Okay, so we know what hemorrhoids are and how they occur, but what actually causes them to happen? Well, probably the commonest reason for hemorrhoids to occur is people who strain on the toilet. Now, this could be because they are constipated, for example, and this might be that you're passing stools that are really firm or hard and require a lot of pushing. Now, you can imagine that if you're pushing really hard onto those small little veins or vessels, you're going to be hindering that blood flow back into the heart, and so you're causing that distension of the veins, and hence, over time, will cause some hemorrhoids to occur. So it is really important to make sure that if you are somebody who is worried about having hemorrhoids, or you do indeed have hemorrhoids yourself, that you take a look at your bowel hygiene. Now, this means taking a look at how well you're passing your motions. We usually recommend passing a nice soft stool. You shouldn't really be passing anything that looks a bit like a pellet, for example. It's really hard because that is a sure sign that you are constipated. Instead, if you imagine a sausage, your stool should look rather like a soft sausage. The other reason that we commonly see people coming in with hemorrhoids is because they're spending a lot of time on the toilet. Now, I actually see this a lot in my younger patients, and they often will go to the toilet and they'll spend like, say, 30 minutes on the toilet just checking on Snapchat, looking at TikTok, and they get so carried away and consumed with their mobile device that they've actually forgotten what they're doing on the toilet. And so as a net result of that is they're pushing and pushing and pushing and pushing and pushing. But guys, what's going to happen if you push too much? You're going to get hemorrhoids. And so that's often what I'm seeing in the younger populations coming through now, is that they're always on their phones on the toilet. So my best advice for you is to leave your phone outside, put it on the vanity, put it somewhere completely far away from the toilet, and just concentrate on what you're doing on the toilet. And hopefully you shouldn't have any straining, and therefore you have a reduced risk of developing hemorrhoids in the future. Of course, hemorrhoids aren't just caused by straining on the toilet or being constipated. There are other reasons that they may occur. If your profession requires you to lift really heavy goods on a daily basis, then this can create a lot of pressure on the tummy and then again cause hemorrhoids because you're putting a lot of pressure on those veins down below. Similarly, we see it in pregnant women because of the abdominal weight that they have. They're carrying around for a good period of time, and also when they're giving birth as well. If they're pushing really hard, they may experience some hemorrhoids postnatally. That means after birth. Most people, however, will have hemorrhoids that are transient. That means that they'll have some symptoms, but they'll usually settle down within a few days. However, there may be other people who have a really long history of hemorrhoids, and certainly we treat all of these people regardless of how long you've had them for. Speaking of treatment, what options are there out there? Now, certainly before your doctor can get to a diagnosis of hemorrhoids, they may wish to take an extensive history from yourself and maybe even perform an examination. Now, sometimes this may involve taking a look at the bottom and even inserting a finger into the back passage using a lubricated glove. Often you'll be asked if you want a chaperone in your procedure so that you feel a bit more comfortable as well. It's really important that you are offered this, and if you do feel uncomfortable with this procedure, please make sure to speak to your doctor about it. By doing this procedure, it will help your doctor to work out if you do have a hemorrhoid and what type of hemorrhoid it is and where the location is as well. However, once your doctor has got that diagnosis, then they can certainly help you with some treatment. Of course, we need to work out why it is that you have hemorrhoids and whether constipation or straining on the toilet may be a contributing factor. If this is the case, then your doctor may require you to have some laxatives, for example, something to help to keep your bowels moving so that you're not pushing so hard on the toilet and so that you can open your bowels freely. If you're on certain medications that could be causing constipation, then your doctor may ask you to review these so that we're stopping the development or the progression of these hemorrhoids. There are some other treatments that are available. If, for example, you've got lots of pain and you're really uncomfortable, your doctor can prescribe you some creams or some suppositories. These will help to reduce the inflammation of the hemorrhoid and hopefully help you feel a little bit better in a few days' time. Of course, if you're one of those unlucky people who've got hemorrhoids for a long period of time, you may be referred to have your hemorrhoids treated. The commonest way to get hemorrhoids treated these days is to do something called band ligation. Now, it is actually what it says on the tin. You'll be referred to a specialist doctor who will place a band around the hemorrhoid, which is much like a rubber band, for example. And what that will do is it will cut off the blood supply to the hemorrhoid, so it's no longer distended and large, and in about 7 to 10 days' time, it will just fall off. In more worst-case scenarios, you may be referred to have a hemorrhoidectomy. This is where a specialist doctor will actually perform a surgical procedure under general anaesthetic to remove the hemorrhoids themselves. However, of course, this will have its own aftercare instructions, and your doctor will advise you of what this would be. But Dr. Nora, is there anything I can do to help prevent hemorrhoids happening in the first place? Well, of course there is, my friends. Having a really healthy diet will help to prevent those hemorrhoids from occurring. As we've said so many times during this video, making sure that your stools are nice and soft, you're not pushing too hard, you're not constipated, is usually the crux of the matter. So giving yourself a diet which is rich in fruit and fibre and lots of water will help to keep those stools nice and soft, allowing you to pass them much easier and reducing the amount of strain you have on the back passage. And of course, as I mentioned earlier, if there are any medications that could be causing you to be constipated, it's probably worthwhile reviewing these with your doctor. Okay, so we know how to prevent them, but what if I do have them already? Do I have to treat them? Well, this really depends on you. If you're not experiencing any symptoms from hemorrhoids, then you could probably just leave them alone. And if they start to bother you in the future, you can speak to your medical doctor about getting some treatment. However, there are some complications that can occur if you do leave hemorrhoids untreated. Now, as a junior doctor way back, I was working in a really busy London hospital, and the next patient I had to see was a lady who presented with hemorrhoids. And I thought to myself, this is going to be a really simple case. I'm going to go over, I'll take her history, do an examination, and I'll prescribe her some suppositories, and hey presto, we're done. However, I was wrong. This lady, and I felt so sorry for her, this lady was literally bleeding so much from her hemorrhoids. So I was really shocked to find out that hemorrhoids can actually bleed a whole lot. In fact, she bled so much that she needed a blood transfusion. And so sometimes if you leave hemorrhoids untreated, you can develop excessive bleeding. Yeah, that's not good. In addition to this, you can open yourself up to an increased risk of infection. And in some situations, a fistula may form. This is a small channel that runs from the skin or the outside of the anus to the anus itself, which can be really uncomfortable. And so as you can see, there are a few complications that perhaps we don't really want to miss. And so if you are experiencing any of these symptoms, I certainly would advise you to go and speak to your own medical doctor for a thorough examination and checkup. So there you have it. We've spoken about what hemorrhoids are, what causes them, what symptoms you could be experiencing, how to treat them, and even how to prevent them as well. I hope you guys have found this video useful. And of course, if you have any questions or comments, please don't hesitate, drop me a line in the comment section below, and I'll see you on the next one. Take care and stay healthy.